So can you just outline the number of vaccines that are being underutilised at the moment at a national level? Why are they being underutilised?
I'm not sure whether there's a logistical distribution issue. It's a patchy kind of rollout where some places in general practice at least have got not enough doses for the amount of demand, and there's other hubs in general practice where they've got a few too many doses. So I think it's really just a distribution issue and trying to get, there are plenty of general practices who are calling out for more supply because they can actually deliver more.
Right, so nothing to do with the GPs themselves?
Not that I know of, not at all.
Okay. Just on that point, I was reading about a doctor, and I know there's many others like this in Bondi yesterday, who said that he gets about 150 vaccine doses a week and they get taken up within a couple of days.
Yep.
So do you believe that those levels should be increased?
Look, I do, because, in last year's flu vaccination season, as GPs did 6 million doses in 6 weeks. We've got the capacity. We're doing, in our clinic, we're getting 500, a batch of 500 flu vaccines at a time. We've got 20 doctors, 4 nurses, we've got a whole floor we can utilise. We're saying we can help. And, there's a role for everybody in this, and it's just getting the doses to the people where the arms are being uncovered. Now, I've got older people who are not really able to get to mass vaccination hubs. And so there's a whole complex logistical exercise of getting the vaccines to the places where the people are. We know general practice can do it.
So take-up has been pretty strong otherwise?
Yeah, it has. There's still been quite a strong demand for it. Of course, we've got some vaccine discussions, and that ranges from flat-out vaccine refusal to vaccine hesitancy. So there's still that cohort of conversations going on, but there's also a very large demand for vaccine.
Just on vaccine hesitancy there, how much of that are you seeing for those aged over 50?
As I've said consistently in the media, virtually every consultation of mine for every patient, and including those over 50 and including those over 70 and 80, is about conversations about vaccine, questions from patients, discussing it. What does it mean for them? How do they interpret it? What is their level of understanding, and going through the science on that. So there's a lot of vaccine questions. Some of that would translate to hesitancy. They might elect to wait, or they might say, look, I'm really happy to hear that. Thank you very much. I'll sign up for my COVID jab now. So there's a whole range of responses, and that's, I expect that would be in every GP surgery.
Right. So, how common is that story, though? And I don't blame people for feeling this way too, given what's going on at the moment. But you might have someone aged over 50 and think, well, I don't want to have the AstraZeneca one because I'm worried about getting blood clots. So I might just wait it out and try and get a Pfizer one or a Moderna one. How common is that story?
It's not very common. It happens, and we go through, well, what would you do if we suddenly got another breakout? And, we've seen overseas, we've seen the potential for variants. That's when the risk-benefit changes. So we always respect patient-led decisions, but we want to make sure that they're informed properly by the science. And so some of that is pure fear. Some of that is, I guess that's a person's decision about what they want to do. Other people won't take that risk.
Just on to the more broad conversation now about interstate travel, Doctor. Do you see anything wrong with having open borders and keeping those borders open once people have had their 2 shots?
I think at every stage of this pandemic, we've initiated new freedoms in response to our very successful suppression. And I think we could look at opening up a little bit more, perhaps depending on the science. But every decision needs to be reviewed carefully so that we're not putting others at risk. And I think that's really a question for the politicians and the chief medical officers.
Sure.
But certainly we want this pandemic over for sure, but we've got to make sure we don't rush into it.
I understand. And just finally, Kenny, our reporter, just mentioned there that the number of disabled residents at the moment who have been vaccinated across the country stands at 999. Total workers in the disabled sector are 1,527. So it's just 4%. And they are part of 1A. How disappointed are you to see those kind of stats?
Look, it is disappointing for the families. That must be terribly worrying. So, but what I understand, part of the difficulty is that many of the disabled population are in separate homes rather than collectively in one place. So there's been lots of discussions from the state departments about how to manage a particular outreach for these citizens. And so I think there's been a logistical challenge in getting to a lot of different, very small populations, and that's been part of the issue. And I guess that's a design issue within the rollout. But again, we're fortunate that we don't have a lot of COVID in our community. So I guess we do need to hurry up on that, that's for sure.
Okay, Dr. Karen Price, the President of the Australian College of GPs. Appreciate your time. Good to chat. We'll talk to you soon.
Thank you. Bye-bye.